Hey, so this past Sunday was Mother's Day, and so I thought about it, and I want to help my mother retire first before I retire, and so my plan is to take over her book of business by the time she turns 60 in August 2016. That's my goal, and be fully independent and running the whole show by January 2017. So I'm going to also be. I don't like P&C, property and casualty, but I have to maintain her book of business, and so I'm going to be learning more about P&C as well, and commercial insurance agent as well. She does that. She focuses mostly on P&C and commercial insurance, and so we have a commercial insurance agent now. Us, yeah, as a team, and but so that's my Mother's Day gift to her, to do everything I can to take over her agency by August 2016 when she turns 60, so she can retire. And so focusing on today's lectures on Medicare. This Part A, basically, Medicare covers like hospital visits and in-home nursing care. So basically the deductible for Part A, $1,260. That's across every company in Washington. That's the standard deductible. That's what you have to pay if you have to go to the hospital for the first 60 days. After that, you have to pay the co-payment of $315 a day for the 61 to 90 days. And after 91 to 150 days in the hospital, say you have a really major illness or something, you pay $630 a day out of pocket, and the maximum out of pocket is $37,800. After 150 days, you would have to pay all the costs. So that's where long-term care insurance really comes in handy.
The average Medicare stay is 21 days they pay for. After that, you're even though they say they'll cover up to this amount of time, they don't. If they don't think you're going to be able to recover from whatever your sickness is, you're out.
That's where Part B comes in handy. Part B is the doctor visits, and the original Medicare, when it was passed in the 60s, it only had Part A and Part B. Part B is the requirement for Part B is you have to be 65 years of age or have a long-term disability. If then you are eligible to qualify for Medicare at a younger age. Say you have like a late-stage renal disease or something, you have a disability that you're qualified for, then you would qualify for Medicare prior to 65. And think that with United Healthcare, the requirement is you have to have worked in the U.S. for 10 years before that to be able to be eligible for Part B. And if you haven't, then you pay a premium for Part B as well. And so I have go ahead, pass that around. I have some more info on, if you want anyone that wants literature on which Medigap plan to choose. That was the Medigap Part C and D were passed in 2005, I believe, by Congress to cover all the gaps in the coverage of that Part A and B don't cover. And so which Medigap plan to choose? If you are interested in reading about that, you can pass that around. There you go. This one's just like a cheat sheet for the different types of plans, if you want to glance through it. This one's I brought this as a quick underwriting guide reference for the United American, which is they are a private company that only does Part C and D. They cover the Medigap plans. So that's a private company that works that are qualified with all the government agencies and stuff. So it's privatized Medicare. Yeah. Any questions?
Well, I think by the time Medicare gets around to all these young people, it's going to be whole drastically different than what it is now. I've seen Medicare change a lot in the last 2 years. Obamacare has really affected Medicare, but hey, we're all going to die.
Yeah, go ahead.
Under Plan A, Part A, when you said 1 to 60 days it's covered.
Yeah.
Let's say they try to kick you out every time that you call your prepaid or Legal Shield representative and have them deal with that, so you can get your up to 60 days.
Yeah, if you're not being treated fairly, then yes, definitely.
Well, I mean, but if they're going to kick you out
Yeah.
on the 22nd day, though, I mean, that's not fairly, is it?
No, then you call an attorney. Yes.
Usually the reason they kick you out is because you're not trying to get better.
Gotcha.
So my sister-in-law went through this, where she broke her hip, she was in there for 3 or 4 weeks, and they said they're not gonna pay anymore unless she does the physical therapy, she wouldn't do it, so
Right.
she ended up having to pay herself.
Yeah, they're not gonna unhook you, you know, and roll the bed outside and dump you over.
That's what it sounded like over there.
Well, that's, John would do that, but, you know.
I know what you're overseeing my health. God. Okay. Nice.
All right. So yeah, if there are any questions, health insurance, legal insurance, commercial insurance, anything that Mandan doesn't do, I'll happily help you out with. So,
Thank you.